name's Dallas Wolf. My student number is 000473833T. This is my resubmission for my practical assessment for anatomy and physiology as requested by Dr. Gayeth Al-Badri. My chosen mode of study is nutritional medicine, and I would use dietary intervention when treating my patients or clients. Now, a particular condition that I would treat would be anemia or iron deficiency, it's otherwise known as. And what that is the body's lacking circulating oxygen, and it's the red blood cells that circulate oxygen through the body. And if they're not doing that properly, that's probably because the body's lacking iron. Now what I do is I ask the patient to do a bit of a 7-day diet plan, and with that I would increase the client's intake of meat, red meats, and green leafy vegetables in general, but green leafy vegetables, whole grains and eggs, things like that. The client would probably be showing symptoms of irritability, pale, clammy, a low immune system, so they're possibly sick. After the 7 days, I'd ask them to come back and see me again. We would test it with a blood test and just see what that level's like, and if it's still low, we would reassess it for another 7 days. Another condition I would treat would maybe be cholesterol, in particular high cholesterol. A lot of people are mistaken in thinking that cholesterol in general is bad. Too much of anything is bad, but cholesterol is actually good for you. It creates hormones for the body, and bile acids, stomach acids break down fats and vitamins so that the body can digest them properly. Now, if a patient came to me, they wouldn't be really showing many symptoms. They probably have already had a heart attack or something like that. That's really the only symptom that a person has high cholesterol, unless they've had it tested. Now, cholesterol clogs the arteries, and high cholesterol then would lead on to, or clogged arteries and high cholesterol would then lead on to heart disease. Again, I would set a eating plan, possibly longer than a week though, maybe 4 weeks, and that would be, we would look at changing the diet to very much low in saturated fats, or your sort of processed foods, and increase your monosaturated fats and your polyunsaturated fats. So we would cut out all sort of fat dairy foods and turn them into low dairy foods. Lean meats, so you incorporate sort of kangaroo fillets and things like that. Fish, definitely a lot of fish, and cut out any of your dairy, processed kind of meats from the deli. And then we'd also ask to increase fresh produce, vegetables and fruits, and increase some exercise, moderate exercise, but definitely get an exercise plan happening. Now, a couple of things that would be outside my scope would be mental sort of psychological issues. People suffering from depression and things like that would need to be dealt with by a psychologist or a counsellor. Definitely not something that I would be able to give advice on. And another thing would be anything muscular, muscle tears, strains, things like that, would need to be referred straight over to a physio. The next thing I need to do is a vital signs assessment, and I will go and get our patient. One moment. Third time. Come and take a seat, Ryan. This is our patient, Ryan. And Ryan, is it okay with you if we check your temperature and your blood pressure and whatnot?
Yes.
Good. So what we've got here is an electronic thermometer and our alcohol swab, and we'll just wipe it, make sure that nice and clean, and we're going to check orally Ryan's temperature. So we just turn it on, and when it's flashing low and it's flashing, we'll pop it in under Ryan's tongue in the heat pocket. What do we get? And it's still going. And there we go, it stopped flashing. It started flashing, I should say, on 35. Can you see that? 35.4. So we'll record that on Ryan's file for his next visit, and we'll give it a little clean so that our next patient, it's nice, everything's nice and clean. So what we're going to do now is just measure Ryan's respiratory rate. And we need to do that by finding his pulse. So we're going to do that for about 15 seconds. We've got about 15 times that by 4, that's about 60 beats per minute, and that's pretty average for this time of the day. Ryan's come home from work and he's nice and relaxed, so 60 sounds good. The next thing that we'll do is we'll check Ryan's blood pressure. So we'll just make sure that's deflated, it feels a bit puffy. Now we've got a normal sized cuff for a normal sized arm. And we'll pop that on the sleeve on there. We'll just put that over there so that it's nice and not too tight. And Ryan's arm sitting nice and level with his heart. And what we'll do first of all is pop this under the crease. There we go. And pop those in so that they point downwards in the ear. Find Ryan's heart rate again, pulse I should say. Now we're going to pump this up until we can't hear Ryan's heart rate anymore. Okay. And then what we'll do is we'll release the dial until we can hear Ryan's rate, and that will be our systolic reading. There it is on 100. And then we'll release it again for the diastolic reading until we can't hear Ryan's pulse anymore. And there it is at 40, so that's pretty low, but again Ryan is relaxed after work, but we will record that for his next visit. Now also while Ryan was here we just sort of counted his breathing rate, and it was sort of for about 15 seconds, and you times that by 4, and he ended up with about a reading of about 16 breaths per minute, which is pretty normal, and that's no need for referrals to a GP. Ryan seems pretty fit and healthy, so that's it.